Okay? Let's go back then to the bleeding. Okay? When we look at blood that's escaped the blood vessels, that blood outside of a blood vessel, so here's my blood vessel, my red blood cells are circulating in here, they're just as happy as can be, they're picking up carbon dioxide, they're dropping off oxygen, and they're just flowing nicely through the body. Now, I suddenly have a trauma, and it opens up and it allows those red blood cells to escape, and some of them are broken as well. And it causes a huge neurochemical release, okay? So you'll see the redness, the swelling, the inflammation that comes very, very quickly due to blood outside of the blood vessels. And what happens here is there is a specific neurochemical release called Bradykinin. And bradykinins, Brady refers to pain. They stimulate or cause pain very quickly. And this bradykinin release associated with blood outside of the vessel is extremely noxious to the system. If you think about it, that bruise, how tender it is, that when you slam your finger in the door, ouch, it hurts so badly, and that blood outside of the vessel becomes very, very painful. That blood outside the vessel, though, is stimulating a histamine and bradykinin release, which is, again, very neurotoxic or very noxious to the body. The ankle that's been sprained and the kids walking around. The person who's had the surgery on their knee where they've actually had to lob off the ends of the bones to put now a metal interface, that is extremely noxious. And you'll see the blood that goes down into the leg, that whole leg becomes very achy, those muscles, very painful. So as we look at this, there are some things that we can do. Remember, our first case scenario was the lady who'd been in the blunt trauma with the car accident. What we had to do in her case was actually recommend, if you are not sensitive to pineapple, the extract of pineapple is called, you remember? Bromelain. Okay? Bromelain has the ability to actually digest some of that clot. But you have to use a very high dosing. And of course, my markers are so well utilized during the day with my little artists that come and go. Let me try to make that a little darker that you might be able to read it. Okay? So bromelain is the extract of pineapples. It's an enzyme that actually has the ability to chew up fibrous clots and fibrous connective tissues, which blood is, the fibrinogen. It actually has the ability to go and scavenge and digest that. But you have to use a lot. Okay? We're talking about 12,000 to 25,000 milligrams a day. So it's very, very high dosing, but it can actually help to chew that clotting up post-trauma. So if you've been snowmobiling and you go over the snowmobile and hit your chest and your chest is so bruised and sore, maybe you've even broken some ribs, a high dose of bromelain can actually help to chew up that bleeding in the muscles. Okay? You've been in a car accident, again, you've had the airbag deployed into your face and your upper chest. Bromelain may be something that we'll want to utilize to help to chew up some of that bleed outside. You've had a facial trauma where you've fallen bluntly onto concrete. You've had, there are multiple fractures in the face where that's bled out, and you'll see the eyes become black and blued, and then they'll go to yellow and greenish purple. All of that would benefit by using bromelain to help to chew up that bleeding. Okay?
Are there any negative side effects?
So the downfall to that is, first of all, if you're allergic to pineapple, you won't want to use this. Okay? The other thing is, a lot of times surgeons will say don't use bromelain within 3 to 5 days of some type of an implant or a transplant. So if we have a cadaver now that's been used as an ACL replacement, if we have some type of knee replacement or hip replacement with metal parts now put in, we don't want to stop or impede some of that bleeding factor. If your loved one is on Coumadin or one of the warfarin, one of the blood thinners. We won't want to use as high of a dose of the bromelain, so we might start them out at only 2,000 units and just see how they do on that, and then build up from there. Okay, so again, the question is, would there be any contraindications to using bromelain? Again, if you're allergic to pineapple, if you're on a blood thinner, or if you've had some type of an implant or a transplant surgery that would create some trauma with heavy bleeding, we want the clotting factor to be very, very present for a few days. Okay, and then after that, we can safely use it. So it's a great question. Any follow-up questions to that? Okay, very good. Now, again, when we look at this type of a presentation, the faster that we can get this blood to break down that's escaped from the cells, the better off we're going to be. Okay, so that's why we want to elevate and milk the calf if I've had a sprained ankle, get that from going out into the toes and getting